So now I want to turn our attention to 4 leaders that stand in the front line of Hopelink's work, and they serve as directors of various programs within the organization. Many of you, members of our community, want to know more, want to hear directly from staff. And this is our chance to collectively hear how Hopelink not only responded during this unprecedented time, but how the organization took an equitable approach to offering the needed services to our community. And in most of these luncheons before, and believe me, I've been to like 15 of this, we typically hear directly from a client. Today, we want to instead focus on those who are in the front lines, our leaders and the staff who work on behalf of the client needs daily. So this is a great opportunity and very unique because we'll have a glimpse into the heart of Hopelink. So for today's conversation, we're going to have Susan Carter, the Director of NonEmergency Medical Transportation Services. We'll have Lucy Payat, Director of Energy and Financial Assistance. We'll have Matthew Campbell, Director of Food Programs. And we'll have Barbara Hagel, Director of Development. So that's the Q&A panel I have. I'm thrilled about this conversation. Let's get started. So first of all, thank you so much for being here. And I have to say this, thank you for all the work you do. It's amazing. The community values it. The community needs it. So thank you for everything you do. So let's start with having a conversation about some of the things that happened during the pandemic. So let's start with you, Susan. You lead non-emergency medical transportation. So the pandemic came, right? What were the abrupt changes that you and your team had to make in order to serve the community?
Well, my team is one of 6 Medicaid transportation brokers in Washington State. We help low-income individuals get transportation to medical appointments. Since we're a broker, we do not provide service directly. Instead, clients will call us, we'll screen them for the most appropriate type of transportation, and if they're unable to use public transit, we'll distribute the rides to one of several contracted local transportation companies. These transportation companies are small businesses that employ hundreds of drivers throughout King and Snohomish County. And these drivers are often in a sedan-type vehicle or a wheelchair-equipped van, so there's not a lot of space between them and our clients. Yeah. We're also a shared ride service, so we could group more than one client in the same vehicle at the same time, and that makes for an even tighter fit. When the pandemic first hit, we didn't know what to do right away. We didn't have the ability to keep people 6 feet apart, and we didn't have the option of shutting down. Even in a pandemic, clients need transportation to medical appointments. We had to figure out a way to get people to dialysis and cancer treatment and now COVID-19 testing facilities. And we had to find a way of doing this while keeping them safe. And that's really when our community of partners stepped in.
Wow.
Yeah. We had drivers, despite the risk, volunteer to transport COVID-positive clients. We had these transportation companies implement really rigorous cleaning standards and get very creative in how they created barriers between them and our clients. We communicated often with other brokers and exchanged information and resources as information changed. Also partnered with the healthcare authority to find ways to alleviate some of the financial burden some of our transportation companies were facing, and also to look for transportation gaps that we didn't normally fill, but there's suddenly a need to fill, and oftentimes out of our scope, like taking people home from quarantine sites.
Yeah.
Individuals and agencies donated PPE and disinfectant at a time when we couldn't find any. Without the community partners, we wouldn't have been able to continue service. So we're extremely grateful for their flexibility and their innovation and their collaboration during the entire span of the pandemic.
Thank you so much for sharing that. I am so impressed with how your organization and Hopelink overall was able to, be creative, find innovative solutions, and also work with the community of partners. Because ultimately, people in need needed to get to their medical appointments, to the testing facilities, and to get the medical services they need. So thank you so much. Great. So Lucy, you lead energy and financial assistance. So how did you see your program working across the lines to provide services during the pandemic?
Yeah, thanks for the question. I love answering this question because I think it speaks to so many of the strengths that we have here at Hopelink. At the beginning of the pandemic, we recognized that rental assistance was going to be a huge need, and we saw it from the calls coming into our centers, a huge increase of requests from people asking for assistance for the very first time, to new arrivals to our country, to those who have worked with us before and saw an already difficult financial economic situation for their household become even more so. So Hopelink committed to a huge rental assistance response. And to do this, we trained 12 team members from our adult education, employment, housing, and case management programs to conduct financial assistance along with our teams, to allow us to provide more financial assistance in the first 3 months of the pandemic than we had the entire previous year. That continues today with the strength of our core team and the partnerships that we have in the communities with the cities and local agencies that serve population-specific communities, our BIPOC communities, our immigrant and refugee communities. And we've also been able to partner with them to use our assistance to reach to those trusted sources in communities in the North and East Side to connect to a broad range of clients who need assistance.
That's wonderful. It looks like your team was able to quickly pivot and address the need. Rent, housing is so important, especially as some of the businesses and the economy was suffering. So it's wonderful to see that Hopelink was there for the families in need and for those individuals that could have been evicted or suffered other challenges if you had not stepped in. Thank you. So, Matthew Campbell, the Director of Food Programs, and I have to say, everybody has heard about Hopelink's food banks, right? So think about this, the pandemic comes, people cannot go physically anymore to those amazing, wonderful grocery-like food banks that Hopelink operates. What do you do?
That's a great question. That's what we had to figure out quickly. Obviously, there wasn't a choice. We knew we wanted to and had to stay open for our clients. So how do we do so? How do we continue to serve food and keep everyone safe? Keep our volunteers, our staff, and our clients all safe. Within 48 hours, I think we've all used the word pivot. We pivoted within 48 hours and created a system where we're pre-packing our boxes for our clients. So we brought in a small group of volunteers, and they continue to come in, and we're boxing shelf-stable foods for our client. So when a client comes to our centers now, they're not coming inside, but we're greeting them at the door with a shopping cart full of food, pre-packed boxes, shelf-stable food, of produce, of milk, of dairy, and we continue that model today. Yeah. And to date, we've packed almost 200,000 boxes of food for our clients, which is
200,000.
Yeah, that's a lot of boxes. That's a lot of boxes.
Lots of
and that's our volunteers and our staff doing that, which is amazing. The other side of it is, we know, of course, that our existing Hopelink clients would need us more than ever. But we also know that untold numbers of new clients, people who've never been to a food bank, would need us. So how do we react to that? How do we welcome them? We made the decision quickly to eliminate all paperwork, all intake. If you needed food, come to one of our food banks. We're not going to ask you questions or make you do paperwork. Come, we'll feed you. We also wanted to make it simpler, so we simplified our hours and made them consistent across all the sites. So instead of having to go to the website and figure where there was an evening food bank, everyone knows that every Wednesday at any of our centers, you can come in for evening food bank and get food. So we wanted to make it simple and easy for our clients, and we're thankful that to date that we've kept everyone safe, our staff and volunteers, and our clients as well.
Wonderful. I also heard that at some point you couldn't take food donations anymore.
Yeah.
So talk about how the business model had to change very quickly.
Yeah. At the beginning of COVID, none of us knew anything about how it was transmitted. So we went very cautious and said, we're not going to bring food in. So we purchased all our food and we quarantined it for 7 to 10 days, because at the beginning we thought it was touch potentially. So that's how we had to react to food purchasing.
Wow, wow. And can you tell me a little bit about the changing face of the Hopelink client and how Hopelink expanded to other communities?
Yeah, so I mentioned briefly that we knew there would be clients who had never had to come into a food bank, and we wanted to make it simple and easy. And that was really the key. When it can be intimidating, come into a food bank. It is intimidating, come into a food bank for the first time. So we want to make sure that we're setting up a system that was easy, welcoming, and inclusive for all. And we feel that we've definitely done that.
Thank you. I am amazed of how the organization pivoted and moved so quickly to address this new challenge and to find new solutions to ultimately continue delivering the services to the families in need. So Barbara Hagel, Director of Development for Hopelink, can you tell me how the community that we have here today joining us, that we know is so powerful and so giving, how did the community respond to the new needs based on COVID?
Well, Jose, as you know from your many years of involvement with Hopelink, we live in an incredibly generous and caring community, and that was never more evident as it was when this pandemic hit. Sometimes it was overwhelming. As you mentioned, I think the biggest aha for us in development was when Matt said, we can't take donated food anymore. We're going to have to buy the food. So we said, okay, we'll see what we can do about that. So we created an appeal which included asking for support for the food and also for Lucy's team for rental assistance. Those were really the two big areas that we were going to focus on or needed to focus on. And the community didn't let us down. Like I say, we've been overwhelmed by the outpouring of support. People calling and wanting to know what else can we do.
Wow.
One of the challenges was we need to pack these boxes, we need to distribute these boxes. Our volunteer program changed from having people come in every day and working directly with clients to we need to get these boxes packed, and we were concerned. But people came out, and they still continue to come out every day just to ensure that we have food when people come to our door. So we are incredibly grateful for this community, for what it did during the pandemic, and for what it continues to do.
Wonderful. We are so lucky that we live in this amazing community, that we have people with great heart and the desire to not only, do what's right, but to ensure that other people have what they need. So we're very lucky to have Hopelink in this community, and we're very lucky to have the amazing support of our donors and active community members that really care and want to make a difference. So thank you so much for sharing your stories. It's wonderful. It's so touching to hear what happened. Thank you so much for all the work you have done. It's wonderful to see people like you inspiring not only your team members, but other people in the community to take action. When we see a need out there, we have to take action. We have to do what's in our power to drive positive change. So thank you so much. And I know I'm not saying that just from my heart. I know I am saying that from the audience, from the community, from the CEO, and from everybody who cares about this community. So thank you so much. And now let me turn things back over to Hopelink's CEO, Dr. Catherine Cushenberry, who's going to have an amazing conversation with Hassan Minhaj.